Well, joining us now, the Australian Medical Association Vice President, Danielle McMullen. Danielle, appreciate your time. Thanks for joining us this morning. Just following on from National Cabinet, it has pushed back its announcements on funding Australia's healthcare sector until April. How do you feel about that delay?
Frustrated patients and doctors across the country. The Strengthening Medicare Task Force put in a lot of work over the past 6 months, and the report does contain a lot of great ideas about strengthening that relationship with your usual GP, and also hints at some things that could have been short-term wins, like boosting after-hours care and more support for longer consultations. But frustratingly, we're all left until April or May, and then implementation some months after that, to really get any practical measures that will help make it more affordable and accessible to see your GP tomorrow.
Okay, well, what about this plan that's underway in 3 states at the moment to allow pharmacists to prescribe, and patients or people would be charged anywhere between $20 to $55 for consultations? So, I mean, according to reports at the moment, the fees, $20 for a simple consultation for something like an eye infection, $30 for a contraceptive pill, and up to $55 for a complex consultation lasting 30 minutes or more. This is to a pharmacist. What's your reaction to that?
That really concerns us. It obviously, therefore, doesn't save the patient any money, and we're certainly sacrificing quality. For that simple consultation, so to speak, and we don't like to use that term, but in general practice, you go for an eye infection, and actually the likelihood is you may also have some other issues dealt with at the same time. And at least with your usual GP who knows your whole health history and has the extensive training to be able to determine whether it is the most common eye infection or potentially something a bit more unusual. So it doesn't save the patient money. It costs the system money in the longer term to mop up the complications and delayed care, and it further fragments our system. We'd rather work in conjunction with pharmacists, work as a team, rather than splitting off and making patients tell their story 10 times over to different people and really not knowing where to turn for which complaints.
Okay, I mean, I know it's in your interest to keep people at the doctors rather than pharmacists, but what about $30 for prescribing a contraceptive pill? I mean, that's a lot cheaper than going your way.
In actual fact, it's often not. I think many practices do offer an out-of-consultation repeat script potentially, and the average fee in many cities is about $20 to $30. Or many consultations, doctors do try and bulk bill patients who need to be for low-income situations, and so we do try our best to keep costs down. It's just that the Medicare rebate has not kept pace with the cost of providing care for many decades now, and doctors are forced to pass on those fees, and the rebate back to patients just isn't adequate for that. I mean, and obviously there's no rebate for the pharmacy.
But sure, but that's where a role for pharmacists come in, right? Because I mean, just being around Sydney at the moment, or the capital cities, you can be $70-80 out of pocket for a consultation for seemingly mundane prescriptions.
I would argue that there is no such thing as a mundane prescription. Australia has very tight regulatory rules to determine which medications need to be prescribed by a doctor, and the TGA has strong processes for that, and which ones can be recommended by a pharmacist. So for states to willy-nilly just override those TGA processes, we would argue flies in the face of quality use of medicines and patient safety across the country.
What about these law changes, and we're jumping topics here, but law changes to allow drugs such as ecstasy and magic mushrooms to be prescribed for certain mental conditions? It is for selected psychiatrists for the treatment of PTSD. Has the AMA got a view on that?
The AMA was not in favour of making those medications, what we call it, a Schedule 8, which is what has happened, although there have been additional very tight regulations put around who can prescribe them. These medications are still generally in their experimental phase, but we recognise that there are patients out there with severe treatment-resistant depression and post-traumatic stress disorder, and these therapies may have some emerging evidence that shows that they could be useful for care. So we're reviewing that decision and recognising that there really are tight controls. So certainly the population shouldn't get the idea that any patient can get it from any psychiatrist.
Right, but you see the upside.
Look, there is emerging evidence that these may show some benefit. We would have preferred there to be a longer period of this remaining in clinical trials before being reduced, before having more access. But the tight controls around it are likely to keep patients safe and make sure it really only is a small number of people in highly monitored situations that can have access to something that's potentially helpful.